My name is Dr. Elisa Mercuro, and I'm a functional medicine doctor in Salem, New Hampshire. You might be thinking, well, what is functional medicine? It certainly sounds better than dysfunctional medicine. Well, functional medicine is basically a systems approach to medical care. So we're looking at what biological systems are out of balance. For example, the gastrointestinal system or the immune system or the hormone system. And that's what we choose to focus on depending on your symptoms and your diagnoses. And really, the other difference about functional medicine is it's really what we call N of one medicine, meaning that, everybody is different, and there's lots of studies out there, but honestly, it only matters if it applies to you. So often, I do some research, I look into things that maybe nobody else has ever looked into, because odds are there are some studies out there that have some evidence that could find something that works for you. So it's very personalized, which is sometimes not the case in conventional medical models. The other kind of big difference as well is that, we often look at all of the events and everything that led up to the current state of health, because everything is important and that affects our biology. And sometimes a little inconsequential thing, for example, if you had a fall and you fell on your tailbone, maybe structurally that changed things, and it was an inconsequential thing at the time, but maybe that made a difference. Or maybe there was a life event, like a divorce or the birth of a child, or something that maybe was a trigger for some of the issues that you're dealing with now. And we can often gain insight by looking at the timeline and putting together, the story of your health.